I've got Gilliyan Carter-Morgan on the line. Hello, good morning.
Good morning. Sorry, I'm a little croaky this morning.
Are you croaky? Well,
A little.
Right, now, Gilliyan, you deal with horses. You do remedial massage. Just give us a brief outline of the type of work you do.
Really, I deal with the horse from both a muscular and skeletal point of view. So using my hands and various massage techniques and stretching, I can help alleviate tightness, soreness, and hopefully rectify any sort of, muscular problems that horse may have, which in turn affects the skeletal structure and hopefully keeps them in tip-top form.
Mm-hmm. And when you go in, this is normally for lame horses, is it?
No, not necessarily. I treat, family pets, competition horses. I do obviously liaise with vets and work with injured and lame horses, but I actually find it's more the leisure horses that I'm treating.
So this is not the T-touch?
No, it's not.
Entirely different. Now, I've got a caller on the line. Hello, good morning.
Oh, hi, good morning.
I understand you might have a question, or you do know Gilliyan, is that right?
Yes, that's right. Oh, hi, Gilliyan. I don't know if you remember me.
Hi.
Hi, you
Yes.
came to see my little pony, Dolly.
That's right.
What I want to share with the audience listening is what conflicting advice can do to an animal. And what happened with me, basically, is that my horse fell in a field, and to me, she became lame. And when I called the vet in, they said, yes, she is lame. And they gave her medication of bute, which is like the equivalent to Nurofen. And I noticed after a week that she was okay. And then I thought, well, what would happen if I took her off vet? And then she came lame again. So the tablets that the vet gave me were actually masking the problem. And then I called the vet back. There's quite a bit of expense starting to accumulate now. And the vet was like, it's probably nothing. It should be fine. But then you've got busybodies in the world, haven't you? In the dog world, in the cat, and the horse world, everybody's got an opinion. And I said, oh, she's limping, she's lame because she's got laminitis. So then another expense, I had to have the farrier in. And he was adamant, no, she's not lame because of us. We've done our job. There's nothing wrong with her hooves. She's fine. And I was on a cycle of going, everybody has an opinion. We even got the saddle people in. More expensive, perhaps it was the saddle one.
So what happened in the end? You managed to get hold of Gilliyan?
Well, no. Some busybody actually recommended Gilliyan. And if it wasn't for Gilliyan, my horse wouldn't be perfect now. And that's where you can continue what happened with my pony. I visited, did my diagnostic test with Dolly, and discovered that the problem was actually in her shoulder from the fall in the field, and it was actually a muscular problem. And obviously, with the fact that muscular problem hadn't been dealt with other than by anti-inflammatories, which is there to actually relieve that kind of a problem, it wasn't getting rid of the symptom, and therefore she was continually lame. And I'm very pleased to say, after one treatment, Dolly seems to be 100%. Thank you very much for letting me know, Sarah.
So really then, Gilliyan, what you're saying is if people are going to the vet, and I've got one staring at me at the moment.
Oh, yes.
If people go to the vet and they get a treatment and they don't get a result, they should be looking a lot deeper.
Or asking their vets, definitely, if there are any alternatives, because, not disrespecting any vet in any way, but they have an awful lot of a broad spectrum of knowledge on, every day and run-of-the-mill tendon problems, wound management, all those sorts of things. But if you go to your GP with a back problem, they will send you home for bed rest, give you anti-inflammatories. If it isn't any better, go and see a physio or go and see a chiropractor, and they send you to relevant specialists. Yeah. And I think that's what needs to happen more so. Certainly in the UK, where they recognise that actually we have specialists now that are soft tissue related and muscular, and we have them that are skeletal, and to let the owners have other options rather than the pony just continually having a problem. And how the horses work will be that problem will turn into a greater problem.
Gilliyan, I have to agree with you totally.
Yes, which are even bigger problems.
Yeah, there are so many things exactly in general practice that you can do and that you're experienced in, but there are certain problems that go deeper and need a different treatment. And with a lot of muscular injuries, the ability to deal with those, is more in your hands.
Yes.
Yeah, what we can
absolutely.
do is, like with the anti-inflammatory, you give the area rest so that they don't overuse other muscles and don't walk in a wrong way. Yeah, but you're not really dealing with the muscle itself. And if you can do that with a hands-on treatment, that is fantastic.
Yes, absolutely. And that, that's where...
I do want to know how you do it, though.
Yes, very true. You need the right training. That leads on to a whole other subject, but yes, the right training is imperative for the therapist. But having good relations with the vets that you're working with also is really important, because here in the UK we cannot practice on horses without veterinary approval. And I'm actually quite lucky in the areas that I am based, because I've been doing this a long time, and the vets now have seen the results and are quite happy to almost give me a blanket to go ahead and do the work, because I liaise with them so well.
Mm-hmm.
Very good.
And obviously, the results are in the proof of the pudding, like Sarah's little pony Dolly.
Yeah.
So I'm really pleased about that.
And Dolly's been perfect ever since, has she?
That's super.
Dolly's actually fine. What this has taught me is what surprised me is that the problem, I thought, and everybody else, was coming from her back legs, and it wasn't. It was coming from the front, from her chest.
Mm-hmm.
And that was an education in itself. But what I'm saying to other viewers, it's like...
Listeners, no viewers here.
Well, the listeners...
They'll be on next step.
We are afraid of cost as well, because everything's a cost, and the bigger the animal, the more expense. Yeah. But actually, I'm delighted to see her gallop round the field, and you can see pain in their eyes with a horse.
Yes, now I want you to have a listen to this.
Gilliyan Carter-Morgan is a leading sports and remedial massage therapist. She has a wide range of treatments for horses and humans.
Should have done that at the beginning. I'm sorry, Gilliyan.
It's all right.
but you got it. Right, so the thing is this. If anybody does have a problem with an animal, and I'm speaking to you, Nestle, at the moment, and they go to the vet and they're not getting anything, no result, they should be speaking to the vet and saying, look, I'd like to get a second opinion, or can you recommend? No?
Exactly.
Yes.
That's what you should do. I had a little doggy in that had, the cherry eye, when in the eyelid that gland pops out. And there's two techniques in doing that. And one technique is quite tricky and only 80% successful. That means that someone that is very experienced in it, and does it lots of times, will have a much better result than me that has to do it maybe twice a year. And I will refer that dog to an ophthalmologist, which is an eye doctor.
We don't use long words like
Sorry. An eye doctor, to give that animal the best chance to have his eyes fixed.
Yes.
Yeah, and I think that goes with everything.
Well, I think that's very good when vets do that, but there are a lot of vets that just don't. In the case of this caller here, the vet did not refer her on.
Yep. And didn't even locate it on the front leg, which is also...
Change your vet, madam.
Oh, dear.
I
don't know if she's still with us or not. Are you with us there from Derby?
Yes, I am listening, actually.
Yeah.
I think another good thing is, because we know our animals so well, most animals show pain, I think, through their eyes.
Yeah.
And I think that's something that people should pick up on, as well. In fact, I've recently had an awful experience with one of my cats. And she wasn't well, she wasn't looking well, she wasn't eating, and she was constantly in the cat litter tray. And I took the cat to the vet the other day, and she had every single check, and they couldn't find anything wrong with her. They said her heart was fine, her pulse...
We're not doing very good as vets, are we?
Well, listen...
you got the wrong vet.
She said, well, I can do a further blood test.
How much?
£85, and that would tell them how her kidney and bladder and everything else is functioning. And I looked at the cat and I thought, I do love you, but let's just see how you go for the next week. And you know what? There's nothing wrong with her. So can you explain that to me? Why was my cat in the litter tray? I can't find anything wrong with her, and that she wasn't herself.
Well, this is, Gilliyan, I think the work that you're doing is great. I notice it states it's all horses. Do you venture into any other animals?
Funny you should mention that. Because 2 weeks ago I treated a cow.
Oh, wow. Mm.
Aren't they lovely animals, cows?
They're clever as well.
Yeah.
I have to say, I wasn't really sure quite what to expect.
It wasn't my mother-in-law, was it?
No, it was a lady quite north of Nottingham, and she shows these cows, and it's a yearling heifer. She loves it to bits, and it's been bullying in a shed, which I believe is something to do with, coming into season and getting a bit fruity. And these three have been sort of cavorting around in the shed, and she'd injured herself, and she was very stiff. And she'd asked her vet, and funnily enough, her vet actually said, you need a horse physio. So her vet's obviously very good. And so to cut a long story short, I went and had a look and basically treated the cow like the horse. Did the tests the same, my diagnostic tests on the skeletal and muscular system, and did the massage, and the results were quite amazing. We do actually think she's got a little skeletal issue going on, so again, I referred the osteopath to go and have a look. So the cow's getting the best treatment all round, and the client's really happy, the cow's getting better. So, great results all round.
Sounds like old MacDonald at a farm. Now, you
in comes the dog.
And you also treat the humans, don't you?
I do, yes.
Yes, that's very, very good. Well, look, I just want to mention something. It's coming off animals for a minute, but this is something I'm very happy to tell you. I've just had an email come in here to tell me that my granddaughter just got a grade 5 with distinction on piano. So
wow.
Clever Hannah.
I'm going to give her this.
Well done, Hannah.
Yeah.
It's all down to the mother, you know that, don't you?
OK, then, well, thanks very much for your call today. And now, to close up, is there any final advice, Jill, you can give our listeners?
Oh, advice. Trust your gut instinct, in all honesty. If you feel that you have a problem with whatever animal you have, to be honest, your family cat, your dog, your horse, whatever, you know that
yourself.
animal better than anything else. Yes, trust yourself. And if you know you're not getting to the root of the problem, don't be frightened to ask for a second opinion or a referral. And if you can't get it from the professionals that you want, get it from recommendations from friends, relatives who have had similar issues and managed to get results from good practitioners.
Yes,
what more can I say? I think,
good advice.
You do know your own animals better than anyone, so...
Well, all right. Well, thank you very much, Gilliyan, for coming on. I shall send you an email later and we'll get you in again very shortly.
That's super. Thank you very much for having me again.